Dr. Peter Yoo, the official tooth doctor, and he's going to break down and give us some answers about just questions we might have about dental care. So the toothbrush doesn't remove 6 months of tartar 30 minutes before your dental appointment. I love that quote. It's an unknown quote, but we've seen that probably on a meme somewhere.
Somebody walks in, hey, can I brush my teeth before I get my cleaning? I was like, why? You're gonna clean it anyways.
I'd probably do a better job. The National Institute of Dental and Craniofacial Research has said that 92% of adults 20 to 64 had dental caries in their permanent teeth. Yeah. Everyone knows what they should be doing to take care of their teeth, but yet so many people just don't do it.
We get into habits and routines, and that's one of the things that we try and encourage is about changing those habits, trying to build new good habits. But yeah, we always do things that we want or like and don't feel like. So
yeah, do them with discipline at first till they turn into a habit. Yeah. So should people visit the dentist every 6 months?
No. Yes. Seeing the dentist every 6 months I would say maybe an average person should see the dentist every 6 months. Usually you come in for a checkup, and then your dental hygiene, your maintenance, making sure the gums are healthy and the teeth are healthy, and then coming back in 6 months just for recare, or just getting some scaling, just remove some of the tartar is helpful and routine.
Okay.
Now there are people that need to come in once a year, or maybe they need to come in twice a year. I know people that take care of teeth very well, and every time they come in once a year, I'm like, wow, things look good, everything is doing okay. But I do see sometimes those patients say like, oh, I don't need to come in, and they wait 3-4 years, and then they come back and they have 3 or 4 cavities. So I really strongly encourage minimum once a year, routinely, just coming in every 6 months. But there are patients that have some health issues. They have gum disease, they have bone disease. So those people, we sometimes for our hygiene maintenance want to come in every 4 months or every 3 months. And so there's certain rules and certain measurements that we take that give us a reason for getting our patients to come in sooner to make sure that we can get back on track with their dental health.
Okay. And are x-rays necessary every time, like even every 6 months or every year?
Well, our radiologist at our school gave us a little form that stated if you come in for x-rays and you don't have any cavities, then actually you should take x-rays about every 18 months. But that's about 1.5 years. Now most people, again, a lot of people don't come in every 18 months, they come in once a year. So routinely we'll take x-rays once a year. We get the patients saying, oh, my teeth are good, I don't feel like having x-rays. Then we'll take them maybe 2 years down the road. Okay? Now, the opposite. If you have x-rays and you have 3 or 4 cavities, they actually say that for proper maintenance, we should actually take x-rays every 6 months. Okay? Because if you have 3 cavities, there's a probability that you have more, they just haven't shown up on the x-ray yet. So coming back 6 months and taking x-rays to check. But again, a lot of insurances don't pay for x-rays every 6 months, they just come every year. And a lot of times people don't come back in 6 months. So, you know what, then those are situations where we would encourage to take x-rays once a year.
Okay. Are some people more prone to tooth decay and gum disease than others?
Yes.
Okay.
I knew it. It's very frustrating when you see a person that comes in and they brush their teeth twice a day, 3 times a day, and they come back every year and they have 3 or 4 cavities. It's also frustrating for people to know that there are people that don't go see the dentist for like 8-9 years. They brush once a day and they have 1 cavity. So a lot of it is due to the bacteria. There are certain bacteria that cause cavities. So if you have a low concentration of it, you're less likely cavities as opposed to people that have a higher concentration. But there are other factors in terms of your diet, your saliva, the amount of calcium you produce, things like that.
Right. How often should people brush their teeth then? I've heard 2 times a day for sure. Is it necessary to go even more than that?
You know, all of it is just maintenance and care. So, you know, I routinely tell patients twice a day is important because of the bacteria, how they cycle and how they grow from baby germs to adult germs. That brushing twice a day helps to minimize their growth and ultimately minimizes them, they're causing the damage, they're causing the gum disease, causing the cavities. So, and I stated before in another video that here at the Tooth Doctor, we find that patients that brush once a day on a routine basis tend to get anywhere from like 4 to 10 cavities, whereas people that brush twice a day get around like 1 to 5, right? So it's a lot less, and if any. So
right.
Yeah.
Okay. Is mouthwash helpful when you're at work and maybe you can't get to the bathroom and brush your teeth? Is it helpful?
It is very helpful. I think that using mouthwash on a routine basis will help strengthen your gums. I actually met a lady in her 80s. She has all her teeth, and I asked her once. I was like, oh, you know, most people when they're 80 have dentures or lost all their teeth. You have all your teeth. So what do you do? She actually said, you know what? I brush my teeth in the morning, regular toothpaste and brush. Okay. In the evening, actually what I do is I actually use mouthwash. I swish around for 30 seconds. And then I actually, while the mouthwash is in my mouth, I actually brush my teeth with the mouthwash. Okay. What I do now is in the mornings I actually brush my teeth. So I actually shower in the morning, and so I have some mouthwash, then get into the shower, and then I brush my teeth. And so if the mouthwash spills out, I'm still washing myself. So it's good and easy. But that was a helpful tip I found, that, you know, once you brush your teeth, you're kind of, when you're massaging the gums, it kind of opens up the gums and the mouthwash will get in there, and it actually really helps with the gum disease, helps with bad breath, all that stuff, right?
Great.
Yeah.
Well, that's good news. How useful is chewing sugar-free gum after meals?
After meals, it's okay. I would say probably kind of between lunch and supper, if you're chewing gum, it just helps for more saliva production. Okay. Chewing after a meal, I think, I wouldn't say that you should do it. If you want to chew gum after a meal, you know, because you don't want to have, the smell from the food that you eat. But, you know, chewing gum and then eating food, if you do it routinely, there's always the concern of, like, you know, muscle, your jaw gets sore and things like that. But yeah, chewing gum does help to produce more saliva, which in turn helps to neutralize a lot of the acids, and then just helps to minimize it. You know, saliva is obviously a natural lubricant, so it helps to keep the area clean and just kind of, you know, flush away some of the food.
Okay. Here's an interesting question. What are some tips you have to keep your teeth clean when you're on a long trip? Maybe you can't brush your teeth. Maybe you're on an airplane for hours.
I know last trip I went to, I made sure I had my toothbrush in my backpack. One little small tip is you don't have to always use toothpaste. People always think, oh, I have to carry toothpaste in my mouth, you know. Yeah, you just get some water, use your toothbrush. The whole idea is you're scrubbing the teeth to remove the plaque and to remove the bacteria from the teeth. So it's not always that you have to use toothpaste. So if you're on a long trip, just get out, click a brush, put the toothbrush away, and later when you get to a place that you can just quickly rinse the toothbrush, it's fine, right?
Yeah. Well, that's a great tip, actually, because that is something I would have thought.
Yeah, because you don't always have to be in front of a sink or, you know, have some water. Just get some bottled water, your toothbrush, and quickly, you know, and then you don't have to spit out the toothpaste and all that, right?
Good tip. How often should you floss your teeth? This is a common question.
Well, again, they say, you know, only floss the teeth that you want to keep. But to be honest, I don't actually tell my patients to be flossing every single day. I think 1%, maybe 10% of the population actually flosses every day. I think I have I have thousands of patients. Yeah. But I know maybe counting on my hands the people that floss every single day. And yes, their teeth are great, their gums are healthy, they have no cavities. Yeah, there is a benefit doing that. But I never push someone to say, hey, you need to floss every day. That's like me looking at someone that never goes to the gym and say, you need to go to the gym every single day. Yeah. You need to eat healthy. It doesn't work. Yeah. So I try and encourage patients, hey, let's start small, once a week. If we can do once a week, choose a day. If you choose a Monday, floss your teeth on Monday. If you forget Monday, then just do it Tuesday. And then the following week, go back to Monday. So in 6 months when I see you, it's like, hey, Johnny, how's the floss going? Good, Dr. Yoo. I've been flossing once a week.
Yeah.
Great. And then slowly build from there, right? So, we want to encourage patients to do things that are healthy, but in baby steps, right? You can't just jump and be like, Mr. America.
Yeah.
You can't just all of a sudden start running and then, win the 100 meter dash, right? So, yeah.
Yeah, you don't want to be overwhelmed.
Yeah, things take time. They actually, I've heard of studies saying that people, New Year's resolution, right? Everybody says, I'm going to start going to the gym, I'm going to start flossing. 2 weeks later, you stop. What can you do, right? So we want to try and do things in small steps that are reasonable and rational and make sense and doable.
Yeah, exactly. Are there any other tips or tricks to getting into good habits when it comes to the oral hygiene? So you've given us a really good one with the flossing, taking a step at a time.
Yeah, good habits. I do tell patients in terms of I do have some patients where they brush once a day because they eat supper and then they're hanging out and watching TV and then they fall asleep on the couch or they're busy studying and things, or they're just so tired they just fall to bed. Right? So I tell patients, hey, let's try and change that habit. Maybe after you eat, shortly after, quick brush teeth, and then go back to your studying or watch TV. I met a friend. She's a hygienist now. She actually says what she does sometimes is when she watches TV, she doesn't watch a lot, but she watches it an hour. And what she'll do is she'll bring floss with her, and she'll watch TV. And so during the commercial's 30 seconds. She will just click go in and floss. Okay? After the commercial's done, she's done.
Yeah.
Right? Realistically, flossing only should take 30 seconds.
Yeah.
But people always just find the hassle of doing it and think I never have time to do it. That's
not really true, is it?
It's just that we don't want to, right? Yeah. So different tips of trying to get into maybe a discipline that is helpful and trying different things.
Yeah.
I know patients that they don't like using toothbrush. Hey, let's try an electric toothbrush. It's more fun for kids.
Yeah.
Making sure that you use toothbrush properly, and those are sometimes more motivation of getting that done.
That's good. Good tips. Thank you very much. Thanks for joining us here at the Tooth Doctor YouTube channel. Don't forget to subscribe to the channel, like the video if you got some good information out of it. Again, it was lots of great content and information that you gave us to just think about how to make better habits, make it doable for us. So thanks for joining us, and we'll see you guys next time. Bye.